So today we're going to be looking at 5 different organic molecules. I'm studying dietetics, so I decided to pick some molecules related to food and drugs. So we're starting out with ketamine here. So I learned that ketamine is an anesthetic dissociative drug that can also produce hallucinations. A very strong drug used in medicine for patients in surgery. Has a short half-life, so the effects, even though they take place pretty readily, they only last about 30 minutes. Ketamine is injected and also can be re-administered depending on the length of the surgery. And there's also some street use of this drug, and it's known to be involved with sexual assault crimes, which I found interesting. The DEA classifies it as a Schedule 1 drug, which is lower than a 2 or a 3. Okay, so next up we have lycopene. So lycopene is very common in our foods. It's responsible for the red pigment in a lot of fruits. I seen a picture of isolated lycopene, and it was like a really deep red color. So it's found in tomato, watermelon, red orange, pink grapefruit, and guava, just to name a few. Something I thought was interesting was it's the cause of the orange stain that you have in a container after it has tomato sauce in it. And a way to get rid of that is to soak the container in a chlorine bleach solution. Something else I thought was interesting from my studies standpoint is that there's no dietary recommended intake for lycopene, but most people get a moderate amount in their diet just because it's found in a lot of foods. Something else kind of cool is if you eat enough lycopene or excessive amount of lycopene, it can cause an orange discoloration in your skin, which will dissipate after you stop the excessive amount of consumption. So I thought that was cool. So next we have another drug here, ibuprofen. Ibuprofen, an extremely common pain reliever, sold under the names Advil and Motrin. It's analgesic, pain reliever, anti-inflammatory, and antipyretic, so also a fever reducer. It's the safest of the NSAID drugs. And it's also recommended for women who are nursing just because it has a short half-life, and that low doses in breast milk will be lower than anything possibly harmful for infants. So I thought that was pretty interesting. And yep, just used to relieve mild to moderate pain, and can be sold over the counter or given as a prescription as well. So the next molecule we have is aspartame. Aspartame is an artificial sweetener sold under the names Equal or NutraSweet, among others. It is 200 times sweeter than sucrose or table sugar, and even though there have been rumors in the past that aspartame was carcinogenic, oh, I can't say that. There have been studies from 2006 to 2015 supported by the FDA and National Cancer Institute that disproved any of those allegations. And something I found really interesting was it's only stable at a certain temperature and pH. That pH is 4.3. So that's why it's used for carbonated beverages and not really used for cooking or baking because it will become unstable. So for our last molecule we have cholesterol. Cholesterol is a natural sterol produced in the liver of all animals and stored in different areas of the body. Essentially, it's important for the stability of cell walls. It's crucial to the body for brain function and immune system health. It's also a precursor for vitamin D synthesis and transmits several hormones. So cholesterol binds with protein to form 4 different lipoproteins, and 2 very common lipoproteins are HDL and LDL in my field of study. So a high LDL can cause a buildup of plaque in the arteries and cause arteriosclerosis, meaning hardening of the arteries, and that can lead to some more major health issues like coronary heart disease, as well as other types of heart disease. And this concludes my organic molecules presentation, and thank you for watching.